A year ago, my mousie got a bike accident. She was admitted in nearby private hospital. She lost a lot of blood from her mouth, so she required immediate blood supply. But the hospital was not having any blood supply or a system to remove blood. So relative had to visit another hospital for blood supply. We saved her, but her chances of getting worse was there because of the increased damage.
On Pune-Bombay highway, one of my relatives, known as Girish uncle, met with an accident. It was a car crash. The local people called emergency services, but the emergency services didn't reach up in time, and it led to death of my uncle.
It is not only about these people, but it is about 1.4 billion Indian citizens. There are many people who lose their loved ones due to such loopholes in Indian healthcare system. Hello, I am Vaibhav Bangar, first year BMS student. I will be explaining importance of technologies like Unified Health Interface. Delayed diagnosis, incomplete medical history, incorrect blood type, failed communications, unavailability of specialist, language barrier, incorrect medication, ambulance accessibility, loss of medical records, lack of telemedicine access. These are the problems, common problems faced by every Indian citizen. To tackle that problem, Government of India launched Unified Health Interface.
Prime Minister Modi announced the biggest healthcare scheme in the world.
Prime Minister Narendra Modi on Monday launched the Ayushman Bharat Digital Mission.
The Ayushman Bharat Digital Health Mission, a unique digital health ID, will be provided to every citizen using details such as Aadhaar and your mobile number. This health ID will contain all health records of the person.
नेशनल डिजिटल हेल्थ मिशन उसका भी आरंभ किया जा रहा है। भारत के हेल्थ सेक्टर में ये एक नई क्रांति ले आएगा। इलाज में आने वाली परेशानियां कम करने के लिए टेक्नोलॉजी का बहुत सुविचारित रूप से उपयोग होगा।
How UHI will transform Indian healthcare system? What exactly is Unified Health Interface, which can revolutionize four major industries and life of 1.4 billion Indian people? As Unified Payment Interface become revolutionary for fintech industry, UHI will become revolutionary for medtech, health tech, insurance, doctors, and even to the hospitals. Major problem to understand power of UHI, we first have to understand problems prevailing in existing Indian healthcare ecosystem and the stakeholders in the ecosystem. First problem is lack of easily accessible database. Medtech penetration in India is less than 10%. Most of us get handwritten prescription, take it to pharmacy and buy the meds and get well soon. Similarly, with the major health issues, we have giant files with report test results, x-rays, CT scan, bills, insurance receipts, all of them in one messy bunch of file. During shifting or in flood situation, if you lose these files, unless you go to the high-tech hospital in the country, all these critical medical details of the patient, it is very difficult to get rid, or even worse, they can be lost forever. So your doctor will not know the details of your treatment, not exact medicine that you took. Second problem is lack of awareness. People from tier 1, tier 2 cities not even know the operative procedures they were gone through and end up giving the physician wrong information. Third problem is inability to get medical history during an emergency. If man undergo accident and losing lot of blood, hospitals have no way to know whether he is diabetic or not. What blood group does he belongs to? What are the allergies he has? To which drugs he is sensitive to? Due to increased diagnosis time, chances of death goes on increases. Report sharing and getting second opinions. While sharing reports, x-rays, CT scan, etc. to the distant consultant, either the patient has to travel to the consultant or share the reports digitally. While sharing the reports digitally, if the quality of the report is altered, then it is difficult to diagnose the proper conditions. Here, the UHI, Unified Health Interface, come into play. There will be building blocks of UHI. Health information such as health information providers like doctors, hospital diagnostic centers and public health care programs. And there will be health information exchange and consent man, health id, health professional registry, health facility will be done through that registration facility. It is important because it is important to legit doctors and hospitals will get approved, so that this block of UHI will be very important. Another one is health information users like doctors, hospitals, citizen and public health care programs. Citizens will be registered under UHI application or using healthcare ID. Every citizen will get that particular unified health interface ID, and on that UHI application, every information about the patient, that citizen, will be recorded, and it will be shared to the doctors, hospital, and the diagnostic centers. Second dimension of UHI is accessibility. Suppose one of your relatives suffered from heart attack. You will book ambulance from certain hospital. What if there will be no specialist? So UHI will help you in such condition. It will book ambulance from hospital where that specialist is available. Another one is discovery of nearby pharmacies. Suppose you need some medicine, it will provide you information regarding which pharmacies has this medicine. Discovering availability of critical care beds, booking of home visits for lab sample collection. These are the some use cases of UHI. You can use all these facilities through the UHI application or the super medtech apps. Are you registered with the ABHA ID?
What is ABHA ID?
ABHA ID is basically like Aadhaar card, under which you will get one specific health ID. Using that health ID, government will provide you different healthcare schemes, and will your all healthcare data, where are you getting the treatment, all such data will be saved on the different government portals. As we have seen, many peoples even don't know about what exactly is ABHA ID. Many states like government of Goa started ABHA ID registration. As a medical student, I will request every citizen to get registered with the ABHA ID. It will help government to provide you more efficient healthcare ecosystem and to build more healthier India. Thank you.